Hi, this is Bill Monty from the podcast Bill Monty's Guide for Getting Older. And I wanted to take a few moments today to go live. And I'm not sure who will join in. I realize the algorithm and who YouTube feeds it to. And no, I didn't do any promotion on this or anything. But I thought it was time to talk about healthcare in this country. And newsflash, it sucks. And I'm going to talk about a couple of different things. First off, even though I'm wearing a medical smock or shirt, I am not a medical professional. I am a professional patient. And at my age, I've been that for a very long time. And I'm someone who's old enough to remember the way things used to be when it came to healthcare and the mess that it is now. So I wanted to talk about it. Maybe you can make comments. Anyone who joins right now, that would be zero. People who want to talk about their experiences. So here's my experience, okay? And this is kind of what's pissing me off. I live in South Florida, all right? Specifically, I live in Broward County. And that's Fort Lauderdale. For those of you not familiar with exactly where the counties and cities are, that's Fort Lauderdale, so South Florida. Recently, one of the major healthcare insurers, so Blue Cross Blue Shield, decided to go, I guess they negotiate all the time with doctors and hospitals and everything else. So they went up and they started negotiating with one of the biggest hospital systems in Broward County, which is called Memorial Health and Memorial Hospital. Was the first hospital when I was a kid. My father died there. My daughter was born there. It's a major. It used to be one hospital. Now it's like 5 hospitals throughout Broward County. But so months and months and months of negotiations went on between Blue Cross Blue Shield and Memorial Hospital. And at the end of it all, it was decided that they were just not going to have a relationship. So leaving 32,000 people who are insured through Blue Cross Blue Shield in South Florida, scrambling to find new doctors, a new hospital. So, and chances are with Memorial, the hospital closest to you is probably one of theirs, at least in the south part and west part of Broward County. So out of all of this, going up over who gets reimbursed what, it was decided there just was no way to make this work. There was no solution. No one could give enough. And here's the thing that gets me, here's what pisses me off, right? I'm going to diverge for a second. We recently had our ABC affiliate in Miami, which had been the ABC affiliate for 70 years. And Disney, who now owns ABC and ESPN and all that kind of stuff, so they were in negotiation, and these two couldn't come to terms either. So Disney said, well, then we're done, leaving this station out in the cold. Now, they're doing their best to survive and go on. They're doing pretty good and everything. But it astounds me that a company as big as Disney, with as much money as they make between Disney Plus and the parks and movies and everything else, they can't come to terms with a local affiliate who's trying their best to do the good work. So it's the same situation with Florida Blue or Blue Cross Blue Shield and Memorial Hospitals in South Florida, which is you've got billionaire companies that can't come to terms, and it's we the people who are getting screwed out of all this. We're the ones being left to try to make do, because people that are making billions of dollars of profit every single year, if they need a little bit more, how much do you friggin' need? How much? Because we don't have a lot of options when it comes to hospitals and doctors. And I live in a pretty rural area, but if I lived in someplace, a pretty populous area, if I lived in a rural area, my choices would be even less. I don't understand how you could do this. So I'm affected by that. My Medicare Advantage plan is through Blue Cross Blue Shield. So now I'm scrambling midway through procedures for my health. I now have to find new doctors as we're coming up on this stupid Medicare enrollment time right now. And we have to decide, here's what I have found out. In my area, PPOs, so you have in health insurance, you have PPOs and HMOs. So HMO means you have to have a primary care doctor who writes all your referrals if you want to see a specialist. So if you want to see an endocrinologist, you need to see a cardiologist. Your primary has to sign off on that. So there has to be this, which is now, I believe, non-existent relationship between your primary doctor and other doctors and you. The PPO part, which is what I have because I can't stand trying to work with referrals, is disappearing. There's like one option in every single plan, and some plans have zero PPO options, only HMO, which is like when we go back to the 90s when HMOs first appeared. I just want to know, how is this possible? How is it possible that we have gotten to a place in this country, the richest country in the world, if we're to believe what everyone says, our president and the Congress and all that kind of stuff? How is it that we're at a place where we are constantly having to change our doctors? We're having to figure out how to manage our own healthcare. We can't get any help from anybody, anywhere. And the people we rely on to give it to us, the ones that made these stupid rules, the politicians, that's right. The politicians are the ones that did this. And this isn't a Democrat-Republican thing, because I honestly believe, except for maybe Bernie Sanders, that every politician couldn't give a crap if we have insurance or not. And they certainly don't care if we can pay for it. As of this recording, yesterday, the President of the United States met with the Crown Prince of Saudi Arabia and pledged to him $53 billion in airplanes for war. Okay? They're not at war that I'm aware of. They don't need this. I think a country like Ukraine might benefit a little bit more. But apparently we have found $53 billion just laying around that can be given to Saudi Arabia, a very rich country, very wealthy, because of all that black gold, Texas tea, that's in the ground there. But we can't find $53 billion to bail out the American people and the health care they need. Which brings us to Obamacare, or the ACA. Now, I know there are a lot of people who are against Obamacare and the ACA, but the funny thing is the people who are against it are the ones using it. So I don't even understand that. I looked up before coming live on here. Did you know that 45% of the users of Obamacare are Republicans? 45% of the users of Obamacare are Republicans. Of that 45%, 38% identify as MAGA. You want to put people in office who are going to get rid of the insurance that you use and that you can't afford. So because of everything that recently went on in Congress and the Senate with the president and everything with the shutdown, we're now going to see these Obamacare premiums go up. And it's going to become unaffordable for many people. And I have seen this happening. If you're watching social media, if you're on Facebook or anything like that, you're seeing that there are people now saying, I cannot afford. I've already been informed of what my rate hike will be. My God, we just got the government open again. I don't know how they figured out so fast, these insurance companies, what it was going to be. They were really ready for this, right? And they're already saying, I can't afford it. People who were paying maybe $100 a month or $200 a month are now going to be paying $800 a month, $900, over $1,000 a month. You know, as a kick, I just wanted to see if I wanted to not do my Medicare Advantage plan in the upcoming year, if I wanted to just have a private insurance plan as an individual, what would it cost? There was one plan that was $4,000 a month. That was an HMO with a deductible. $4,000 a month for health care. Who the hell can afford this? Who can afford that much money? I mean, what are we doing, people? Why are we? I don't understand why there's not riots in the streets trying and saying we can't, we're not going to put up with this anymore. What was that old movie Network? I'm mad as hell. I'm not going to take it anymore. Why isn't that happening? Because if you don't get mad about this, if you don't get mad about the fact that the government is working to take away your health insurance, your ability to stay healthy and stay alive, or that of your family, of your spouse, of your partner, of your children, of your parents, If that doesn't make you mad enough to take to the streets, then what will it take? I don't understand. I don't get it. I don't understand a healthcare system that says we have these new drugs. So I'm talking about Ozempic and Wegovy and Zepbound and all that kind of stuff. I'm talking about those that you can't have prescribed for you if you're pre-diabetic. Only when you become diabetic can you get that prescribed for you. Wouldn't you want to stop the diabetes? So let's take this step by step, right? You're pre-diabetic, you go on Zepbound, you go on whatever it might be. Yeah, everything equals out. You don't become diabetic. So the care the diabetic needs, the insulin, the needles, the syringes, the monitoring, everything like that, and all the stuff you have to do to make sure your health stays up and constant. All of that right there, you'd rather us become diabetic and pay that than pay the money for the stuff that would stop you from becoming diabetic. And let's take away from even a profit margin look, right? Let's take it just from a human point of view. Why would, if you have the medicine that could prevent that, why the hell wouldn't you want to put that in the hands of every single person that you can so that they can get better? Yeah, okay. So, and they're showing now that these medicines help with cardiac issues, blood pressure issues. Yes, because they help you to lose weight. If you lose weight, that's the point, right? Why are we a country that doesn't care anymore when we have the answer, we have the tools? Why is that? Because we are a country where big pharmaceuticals, big pharma, and insurance companies that make a profit, they're the ones who now control your health plan, your health care, not your doctor. On one of my podcasts, I talked about how I had a doctor I was seeing for 15 years. For 15 years, I was seeing this doctor. And then he bought into a corporate medical group. And suddenly I couldn't see him anymore because I wasn't sick enough. Jesus Christ, really? So now I'm scrambling around all this time, a year later, still trying to find a doctor that could take his place. 15 years this guy took care of me. And now, because he took care of me and I wasn't getting worse, my condition wasn't getting worse, I can't see him anymore because he needs to see people who are sicker. What is going on, America? What is going on? Why? Did you know that before 1972, healthcare was not a profit business? It wasn't. In 1972, you know what happened? Congress, surprise, Congress voted to make it for profit. Since then, the annual profit for a health insurance company is about $25 billion a year. We just let it get taken away from us. All this stuff that can care for us just gets taken away from us. And we don't care, and we're not angry enough. You know, oh, we're worried about the silliest little things right now, which is something that the president is great at doing, distraction. You know, look this way so you don't see this happening over here. Well, come January 1st, 2026, my friends, when you try to go to the doctor with your insurance, even if you're covered by your employer, everyone is reporting that right now is the time that employer insurance, people are finding out how much it's going to cost. It's going up for everyone. Some people, it's not that much. It's nominal, maybe $25 a paycheck extra, so $50 a month, which is $550 a year. But other places are saying that their employers are dropping their health insurance completely because they just can't afford it. Because you understand, right? Your employer is the one that picks up the difference between the $110 a month that you pay in your paycheck and the $4,000 you would pay if you were doing this as an individual trying to get health insurance for you or your family. So how long can we expect our employers to take that? It's everything I've talked about here. It is so broken. It is such a mess. And seniors especially. Let's talk about Medicare for just a moment, all right? So seniors, people on Social Security, just got notified that their cost of living adjustment, their COLA, will increase by an entire 3% in 2026. The cost of Medicare is going up by over 10%. So now you're 7% down. And your Medicare Advantage plans are going to provide less. Many of the plans now don't cover as much, or they don't give you as many extras as they were giving you. I don't understand why we're putting up with this. What has happened to us as a country? We used to care about people. And again, I'm going to say this. I don't care if you're Democrat or you're Republican. Jesus Christ, you have to care if you're getting screwed on this. And you're getting screwed by people in Congress, politicians, who are now guaranteed their health insurance for life. They will lose their job. I want to remind you about something here, folks. They work for us. We don't work for them. We are not their staff. They're our hires. We hire them. And we should be demanding more of the people that we're hiring. And instead, we just accept that they take things away from us while they give themselves more and more. They recently voted themselves another raise. Do you think that was a 3% raise? It wasn't. It was a lot more than that. But we're going to come to a time if we don't accept that we might have to look at socialized medicine the way every other civilized country does, then I don't know what's going to happen to a majority of the people who are lower income. I wouldn't even say middle class, because middle class has disappeared. Now, for all you people go, oh, socialized medicine, oh my God, then all the money would be paid in taxes. I did a little research into that. So let's take Canada, our neighbors to the north right now. How much more do they pay in taxes on average than your average American does right now? The average American, if you are middle class or in that age, you're probably paying somewhere in the range of 22%, right? And for that, you have to pay for your child's education or your education. You have to pay for health care. You have to pay for all this stuff, which is all out of your control. In Canada, that same person making that same salary, but having everything covered, pays about 7 to 8% more in taxes. 7 to 8%, that's it. So yeah, is it a burden? Is it more? Absolutely. But look what you get from it. And I'm not here to advocate for socialized medicine. I don't know if it'll work for this country or not, because we are such a large country. But we have to start thinking about doing something. We can't just sit around doing nothing. We can't have the concept of a plan of healthcare. You can't vote out the healthcare that you have and replace it with nothing. And that's what we're trying to do right now. That's what the people in Congress are trying to do right now. And frankly, I'm going to label this one. That's what the Republicans are trying to do. Republican Senator Rick Scott is from my state of Florida. He was our governor for 8 years, God help us. And now he's been a senator for, I think, 8 years. Also, he is doing everything he can to repeal Obamacare or the ACA with no plan on how to replace it at all. Do you know that Rick Scott was convicted of the largest Medicare fraud in the country ever? He owns a string of hospitals, medical facilities. They're called HCA. I don't know what that stands for. When he first became governor, they were just few and far between. Now they're everywhere, at least where I live. I'm assuming they've grown all through Florida. The person who was convicted of great Medicare fraud is the person trying to get rid of your health care. Okay. That doesn't seem bizarre to you? That doesn't seem strange to you? You know, I can tell you to do a bunch of things now. You can hit like, or you can, I don't know, you can hit subscribe, follow, whatever it might be, all that kind of stuff. But that's not what I'm here. I'm not here to get followers. I'm not here to get any of that stuff right now. What I'm here to do is try to wake you up, because I think we're all kind of walking around in this fog saying, well, everything's okay. They haven't come for me yet. No, they're coming for you. They're coming for your health care. If you're, let's say you're wealthy, right? You don't need Obamacare. You don't need the ACA, and you don't need to have your health care covered by your employer. It's still going up. You're still getting ripped off. Yes, you can afford to do things more private pay, so maybe you're not as worried as someone, say, in my position or the average American. But you still should be concerned. And again, where on earth did you sell your soul if you're not concerned that you don't care about your fellow American? We're supposed to be here to help each other. If you're a religious person, you believe that we were put on this earth by a God who wanted us to take care of each other. Why are you so against taking care of each other? Are you so afraid that some $1 out of your pocket is going to go to, I know, I can hear it right now, the chorus in my head. It's going to go to immigrants, healthcare for immigrants. No, it isn't. It isn't. And I don't know how to make you understand that's not happening, because it isn't happening. You don't have money going to take care of immigrants. But if there is a person who is in this country, let's say even illegally, and they do become seriously ill, do you think we should just turn them away? Do you think we should have no concern for their welfare or their health? Just simply because they're an immigrant to this country? Look in the mirror. If you're not descended from a Native American tribe, you're an immigrant. Your family came from somewhere else. So how about a little concern? I get it. We're all caught up in this fever right now about immigrants and all that kind of stuff. But that can't be the guiding force behind our healthcare policies, because that's not the only thing that we're doing. That's not the only issue. You have got seniors, you have got families, you have got people who cannot afford healthcare. Saw a story in the news this morning. A woman was in active birth. She's pregnant and she's having contractions, and they wheeled her out of the hospital that she's in because they said she wasn't close enough to giving birth. It was still a few weeks away. 8 minutes later, she gave birth to the child in her car. You know who was surrounding the car? Hospital employees, just watching. If you're not angry, I don't know. I mean, do they have to come and take your furniture and your money right out of your wallet, take the furniture out of your home directly while you stand there watching before you get angry or before you get concerned? Aren't you the least bit concerned that, for God's sake, we have no medical care plan in this country that's going to help everyone? If you don't want socialized medicine, I get it. You've got a legit argument if you don't want it. You're not completely wrong, but I'm at a point where I'm ready to say, give it a try, because what we have right now isn't working. But if you're against socialized medicine, why are you against making medicine more affordable for the average American and the average family? I need someone to explain that to me. Explain it to me like I'm a child. Like I just can't understand hard concepts. I need to understand why in America we are against affordable health care. Why? You're not paying the extreme taxes that countries in Europe are, that Canada are, for socialized medicine. And you're getting what you're not paying for, which is zippity-doo-dah. And again, going back to what I talked to at the very beginning of all this, you've got insurance companies and hospitals and doctors fighting over every little dollar, with all of them claiming they're doing it for you, and yet you're the one getting fucked. You're the one getting screwed. You're the one who's not going to have health care. Every single person in that argument between Memorial Hospital in South Florida and Blue Cross Blue Shield, guess what they have that you might not have because you can no longer afford it? Health care. Affordable health care. That's what they have that you don't have and that many other Americans might be losing. I don't know why you're okay with that. We have to do something. And, you know, I can sit here and say, write your congressmen, write your senators and all that stuff. I know you're not going to do that. I did it. I've done it in the past. When COVID was going on, I did it because I needed help with some things. I had some people respond to me. I had the governor, Ron DeSantis, did respond to me. His office did back during that time. There was a little bit of help there. But there's got to be more. It's got to be more of a movement. We've got to constantly be on guard about this. We can't be mad about it for 5 minutes on a Wednesday and then go back to the way things are. Because when we do that, we get to where we are right now, which is not a good place. We've got hospitals and insurance companies arguing, and the decision that they come to is we just won't work together. No, you have to work together. Not working together is not an option. But this is a new America. This is a new America where we just don't talk to each other anymore. This is a new America where a hospital and an insurance company saying they just won't work together anymore is okay. Because again, big pharma, insurance companies, they're controlling our basic healthcare needs. Not you, not me, not my doctor, not your doctor. I'm old enough to remember when you had a problem and you went to see the doctor and you didn't pay anything and you came back and you filled out the claim form and you sent it to your insurance company and they would pay the doctor then. They would mail it. And then you would get information back. And if you owed anything, you would pay it. I'm old enough to remember that when my daughter was born in 1992, as we left the hospital, they said to us, well, you still owe some money. How will you be paying for that? And I'm like, I'll pay for it over time. They're like, okay. It was no big deal. We didn't have to go through a credit check. We didn't have to do any of that. They just sent us a bill, and you can't congratulate me. My daughter was paid off several years ago. We're so far away from that now. In my daughter's lifetime, we have gone from having civil conversations about healthcare, about wanting to work together, to not talking anymore about it at all. We have gone from, since that time in 1992, being able to have that conversation, to having a government and a president who want to see your healthcare taken away or where it's made where it's not affordable. Now, why would they do that? There's only one reason, and you know it. I don't even really have to say it. Profit. Profit. That's what it's all about. That's what it's for. It's for profit. Your life, your health care, and mine, and that of my family and your family, has now become an itemized line in a ledger, a profit ledger somewhere, a spreadsheet, a Google Doc. Somewhere in the middle of all that, someone has decided this person gets health care because they can afford it, and this person doesn't. Even though this person actually makes a pretty good living. There was a time when if you made $60, $70, $100,000 a year for your household, you'd easily be able to afford not only health insurance, but really good vacations and a nice house and everything else. Now, $100,000 is nothing. But if your insurance is going to cost $4,000 a month, and you break down that $100,000, soon you're not going to have any money left in your pocket. Everything's out of whack. In Medicare, with that 3% system, we have a system where they look at the third quarter of the previous year, the inflation rate in the third quarter of the previous year, to decide what the COLA increase will be, the cost of living adjustment increase will be for Social Security beneficiaries. What it was in July, August, and September is what decides. And it doesn't matter if that number has been manipulated, if it's not really accurate. Because if you want to tell me that in July, August, and September of 2025, your cost of living with the increase in the price of food and gas, electric bills, utility bills, everything else, you want to tell me that only went up 3%? You're lying to yourself if you think that. You want to tell me that you can afford to live on that? You want to tell me, look, friends, I know for some of you I'm preaching to the choir, but I feel like someone needs to ring the bell and say, hey, the house is on fire and you need to do something. Somebody needs to do something, because this, in the greatest country in the world, is not the way it should be. It is not the way it should be. Billionaire hospital corporations versus billionaire insurance corporations arguing about whether or not you get coverage is not the way it should be. Seniors living on a low fixed income, having their Medicare costs go up $25 to $40 a month. I'm sorry, Medicare costs go up $25 a month in 2026. And their cost of living adjustment only being 3% is not the way it should be. It's not. So what do? I don't have the answer. I'm here just to tell you I'm mad as hell, and we should not take it anymore. Let Howard Beale become our national mascot, right? Screaming in the wet raincoat on the national 6 o'clock news on the television at night. But don't count on any of our national people doing that, because all you'll do, most of you will sit out there and do is say it's fake news. It's not fake news. People losing their insurance, people losing their houses, people going bankrupt because they get sick. That's not fake news. It's not imagination. It's what's happening in our country. Seniors who did what they're supposed to do their entire life. They paid their taxes. They worked hard. They bought the house. They did it. They did what they were supposed to do. They followed the rules. They followed the rule book to a T. You know, in Florida, if you're on Medicaid, if you want to be on Medicaid, so you're a senior or someone with a disability who needs long-term care, you have to give up all the assets, your savings, your car, your house, everything like that, to where it's under $2,000 in total. If it goes over that $2,000, you lose your Medicaid coverage. You lose your lifeline. Your family and you pay for that. $2,000 was the number that was set when $2,000 actually meant something. When $2,000 could actually pay your rent and be your car payment and everything else. No one has ever considered, for some reason, raising that maximum number of what that asset can be to have Medicaid coverage and Medicaid help above that $2,000 limit. Why isn't it $10,000 now? Can you imagine you're someone who's been diagnosed with cancer or dementia, or your family member is. You're trying to work. You're the only person that can take care of your family member with dementia. And you turn to the state for health, and they say, all right, well, how much do you have in savings? And you go, oh, I don't have much at all. I have like only $13,000 in savings. And they go, great, you got to lose 11,000 of that. Give it away, go buy a bunch of stuff, whatever you want to do. But if you want our help, you can only have 2,000. What kind of system is this? What kind of system is this? That would be our answer. It's the same kind of system that perpetuates having politicians get lifetime health coverage while you and I wonder if we'll be covered the next time we get sick, the next time that we get heavily ill. I don't know what else to tell you, my friends. It's a wild, wicked world, isn't it? Isn't it a strange world that we live in right now? But one of the things that we should be able to at least not worry about is that after a lot of hard work, we can at least afford to go to the doctor, especially if maybe you're a woman who finds a lump in her breast, or you have a persistent cough, or suddenly you're being a little more forgetful than you used to be, or your spouse is. Other countries on this planet do not insist that you become poor to be healthy. And if we continue to insist that that is the case, if we continue to say, no, 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 you can't be healthy and comfortable. We're okay with being comfortably numb, to quote Pink Floyd, but you can't be comfortable. No. You've got to be as healthy as we'll let you be, and you've got to be struggling, and you've got to be miserable. And that sounds harsh, but if I'm wrong, or you can write a comment on here. Tell me I'm wrong. Tell me I don't know what I'm talking about. But I'm going to tell you something. I'm not wrong. I'm not wrong. Healthcare in this country, you should be able to afford it. That's the bottom line. But the fact is, the only thing this country can afford is apparently getting ready to go to war with Venezuela, who I was not aware was a problem in our world. We can afford to fly planes out to bomb fishermen. And maybe they're actually people with drugs on that. Maybe, I don't know. I don't know enough about it to know. But I know if you can afford that, if you can afford to give a Saudi prince who's richer than God $53 billion in warfare, warplanes, but you cannot afford to make affordable health care. You cannot make it possible for affordable health care for a person in this country of low income or middle income or just your average family, then we might be on the wrong side of right, because we should be able to make that happen, not because we're the richest country, but because we're human, because we're people. Even though this is not a theocracy that we have here, you must admit that God does seem to seep into our language and on our dollar bills and everything quite a bit. If you sneeze, people say, God bless you. I don't know why, but they do. Why is it that so many people who believe in God don't believe in helping their fellow man? Shouldn't be that big of a stretch. I believe that's what the Bible tells us to do, right? Care for your fellow man, especially those who really need help. That's what's out there for you, folks. I hope it gets better. I hope, beyond hope, that the Republicans who promised that there would be a health care discussion in Congress if the Democrats gave in and reopened the government, I hope that actually happens. I hope they do that. But I am not overly optimistic on that. I'm not. And I think you know why. Because the majority of, at least every Republican in Congress and at least 8 Democrats don't give a shit if you have health insurance. They don't care about you. The people that you hired, that we hired to represent us, do not care if you live or die. That's a pretty straightforward statement, but it happens to be the truth. Yeah, there's a handful of exceptions. I mentioned Bernie Sanders before. I was a big fan of John McCain, so for those of you who think I'm just bashing Republicans, I'm not. I would love to find a Republican who makes sense. Rand Paul makes sense. I never thought those were words I would say. Even Marjorie Taylor Greene, of all people, is starting to make sense, which lays true, gives us proof that there are perhaps 3 spirits of Christmas that visit you and make you reevaluate your life, like they did with Ebenezer Scrooge in A Christmas Carol. Because if Marjorie Taylor Greene is going to come onto the side of the angels, anything is possible. I hope she does. I hope it continues. I hope there are others that follow her. I hope that if you are someone who supports the current administration, that it doesn't go so far that you don't care about your fellow human beings anymore. And I don't think that's what it is. I know someone who supports the current administration, and he's one hell of a nice guy. I don't think he means any harm to anyone in the world. He just happens to believe that the current administration is the right one for this country this time. Okay, I respect that. And I know that he respects my observation and my belief that that is not true. If he and I can get together and say things are okay, then it's something we should be able to do on a much broader scale. All right. I ask you, if you want to hear more, I'm usually not political, on my podcast, Bill Monty's Guide for Getting Older. You can find it wherever fine podcasts can be found, like right here on YouTube. So go ahead and give a listen. Bill Monty's Guide for Getting Older, or my other podcast, Tales from South Florida. Not all South Florida centric, but it is kind of. But if you ever love Florida or watch Flipper or Miami Vice, you might want to give a listen to that too. And I'm popping up every now and then here. Hey, you want to hear more like this? Go visit America 451. That was a podcast I did briefly around the time of the presidential election. And I think that'll open your eyes. America 451, right here and only on YouTube can you find that. So America 451, Bill Monty's Guide for Getting Older, and Tales from South Florida with Bill Monty. The holidays are coming. I hope that you, my friends, have wonderful Thanksgiving. And give thanks if you have insurance, if you have health care, if you have a roof over your head, if your family is healthy and safe and secure. I hope you give a lot of thanks for that. And I hope that whatever holiday you celebrate as we get past Thanksgiving, be it Christmas or Hanukkah, whatever it might be, I hope you have a joyous and safe one. And keep in mind that it's what lives here in our hearts that can make this world a better place. In our heart and our head. Be kind to each other as we go into this holiday season. I hope you have a great day.